Hello, welcome to GN News. Today we have someone new with us. Hello, Izzy. How are you today?
I'm doing good, Aiden. How are you?
Great. So we have a couple of questions for you. Um. So okay, let's get started. So what is your job like?
My job is nursing. I'm a nurse. I'm a registered nurse. Abbreviation is RN. And what does my job consist of? You mean in general or like in a day?
So like, what do you do in a day? Like,
All right. Okay. So usually as an RN, you work a 12-hour shift.
okay.
So you either work from 7 in the morning to 7 p.m. or you work from 7 p.m. overnight to 7 o'clock in the morning. And a nurse's role, depending on what department or specialty you're on, consists of a lot of different things. Taking report from the previous nurse who's leaving, then
Mm-hmm.
you go see the patients and do vital signs. You administer medication if needed. Um, you pretty much just like interview the patient, ask them if they need anything for pain. Sometimes some patients wear diapers and you have to clean them if they urinate or if they have a bowel movement,
Mm-hmm.
give them water, talk to the patient. Sometimes you have to teach the patient and you have to explain to the patient what you're doing, why you're doing it, and why they need to do it.
All right. I have a question. So basically, what is your job like with the patient? What is your job to
Pretty
do?
much what we do is that we take care of the patient, we give medication, we um we check the patient to see if there's any pain. Sometimes some patients need to be cleaned. We can give them a bath, we can give them a haircut, we can shave them, give them medication. We pretty much take care of the patient.
Okay. So and so basically, compare what does the doctor does to what your job is. So like, let's say
So
like the doctor does one thing and you do another thing.
yes, so what the doctor comes once or twice a day to talk to the patient. But the doctor really needs the nurse. So the nurse is the person who's constantly with the patient. So we are the messenger of the patient. So let's just say you're sick and you're in the hospital and you call the nurse and I come over and you tell me that you don't feel good. And I ask you what's wrong and I come and I check you and I assess you and I find out your arm is hurting. I am the messenger that goes to the doctor and tells the doctor, hey, Aiden's arm is hurting. And when I check the arm is red. So then the doctor says, okay, I'm going to put in an order for Tylenol. And then I go and I give it to the patient. So I'm pretty much taking care of the patient more than the doctor
So basically, your job is like to take care of the patient, and the
at all
doctor's
times.
and
Yes.
and the doctor does what? The
The
doctor
doctor
like,
the doctor takes care of the patient, but not firsthand the way the nurse
all right,
does.
okay. I have another one here. What is basically the worst thing that happened? What is the worst thing that you can think of nurses? Like, what is the worst thing that a nurse can experience?
I think the worst thing that a nurse can experience is something like COVID, where there is not enough nurses to help the patient, so understaffed nursing. And that's a really big problem right now with the nursing shortage, where there's not enough nurses. And then instead of being one nurse to four patients, it's one nurse to 10 patients. And that's a very dangerous thing because you cannot give the patient the quality care that they require because you're running around taking care of nine more people.
Okay, so um, what is the worst thing that the patient that you had? So like basically, the patient. What is like the worst disease that you guys have to deal with? Like HIV, COVID. Like what is the worst disease?
I mean, there's a lot of things, but we can say COVID, because that's like the biggest thing that everybody's aware of.
All right. Uh, only two more questions to go.
Sure, no problem.
Is what is another thing? Like, let's say there's like it's like an emergency. Like they had to like come from the ambulance. So what do you do?
Pretty much what you need to do, the first thing you need to do when the patient comes in is to check for any injuries. So let's just say, just to give you an example, a patient comes in from a car accident and the patient is bleeding like crazy all over the place.
Uh huh.
The first thing the nurse has to do is assess the patient. Stop the bleeding is very important in this case. In that case, is stop the bleeding. Oxygen, pretty much just stabilize the patient
Mhm.
by checking vital signs, blood pressure, oxygen, making sure they're not losing any blood. Because if a patient is losing the blood, they can go into shock and they can die. So you got to stop the bleeding. If it's a patient that has like a heart attack, stabilize the patient.
All right. Okay. All right. Is there any information that we you would like to give to us about being a nurse?
I think being a nurse is a very rewarding career because you get to take care of your community. Also, I think that nurses are very smart and caring. I also think that it is a wonderful career. It's not a career that you do for the money. It's a career you do because you actually enjoy taking care of people. The money's good, but we are understaffed, underpaid for the amount of work that we do. So it's really a career of love. You have to be able to take care of people and love taking care of people, and you have to be a people person. You don't want to give people attitude. The patients come first. You always need to be an advocate for the patient.
Okay. The final question: what type of medicine do you recommend for a patient that like has asthma, allergies, all of that? What is the best medicine? Or like
For
what?
like allergies and asthma,
Yeah, like what is the allergy that you recommend?
uh, good allergy medication is Zyrtec. They have these good orange ones for kids that the kids really like. My son really enjoys the orange pills. You can also do Claritin. They have different flavors as well. They have the nose sprays. They have allergy shots that you can get at your doctor. For adults, they have Zyrtec, Claritin, and Allegra. And for asthma patients, really, you just have to monitor your symptoms and know your triggers. If you know that going to the park is going to give you allergies and it's going to give you asthma, maybe take a Claritin with you, or maybe make sure you have your pump with you and manage your symptoms.
All right. Thank you so much for talking with us. I hope you have a wonderful day.
Thank you for having me. I love
Mm,
your show and I watch it often. And I wanted to say that you are doing a great job and thank you for having me.
okay. Thank you. I'm going to let you go. Thank you so much for
All
this
right, thanks. I
interview.
gotta go back to see the patients. Okay, thank you. Bye bye.
Bye.